Defined as a serious mental disorder where a person's perception of reality is distorted, schizophrenia causes a fragmented pattern of thinking, primarily relating to defining psychological features of cognitive, behavioral, and emotional control, impairing a person's ability to function normally. Recognized symptoms include positive, negative, cognitive defects, and neuropsychological changes, with four types of illness manifesting, such as paranoid, catonic, undifferentiated, and socioaffective disorder. Positive symptoms have no psychological normal comparison and hence relate to the psychotic symptoms. Negative symptoms is the removal of normal behavioral processes, such as providing a lack of response. And cognitive is effective with memory and understanding. A diagnosis is based on at least two of these symptoms as long as they're active. It's seen more in men and women, with men developing it in their mid-teens to 30s and women after the age of 30. Currently, the prevalence of schizophrenia in Australia is about 1.5% of the general population. Globally, 1% and about 23 million people worldwide, with 1.5 million people that will be diagnosed this year. Stressful life events have been known to become triggers for the condition. This includes abuse, divorce, loss of home or job. The drug Quetiapine, manufactured by AstraZeneca, helps by increasing dopamine in the prefrontal cortex and improving cognition. Approved by the FDA in 2006, it's prescription only and in Australia and administered orally. The maximum concentration is achieved at 1.1 to 2 hours with a half-life of 6 hours, and steady state being achieved in 2 days. Finally, it is eliminated in the kidneys. Side effects that are consistent with withdrawal are drowsiness, dizziness, and dry mouth, and it is important to note that there is not much research and studies that have been done via in vitro and animal studies. There is also always bias potential with studies and influence of use to pharmaceutical influences. There may be variances in some data due to dropouts in trial studies resulting in lower efficacy or misinterpreted.
Quetiapine or Seroquel is a second-generation or atypical antipsychotic drug used for the treatment of schizophrenia, bipolar disorder, and major depressive disorder. As such, quetiapine is no less effective than a first-generation antipsychotic, but is distinguished by its affinity profile, lesser incidence of extrapyramidal side effects, and efficacy in treating resistant conditions and negative symptoms of psychosis. Quetiapine is a dibenzothiazepine, typically administered via a tablet, and is converted inside the body to its active metabolite, norquetiapine. Quetiapine's most important therapeutic activity for schizophrenia treatment is as a high-affinity antagonist for D2 receptors in the mesolimbic pathway, reducing positive symptoms, and as an antagonist to 5-HT2A receptors in the brain to reduce the prevalence of negative schizophrenic conditions. Research has shown that quetiapine has a fast dissociation rate from D2 receptors, decreasing the prevalence of side effects in off-target pathways such as the nigrostriatal and tuberofundibular pathways. The decreased risk of side effects makes quetiapine a commonly used first-line therapy for schizophrenia. Quetiapine has undergone extensive clinical trials that consistently proved its efficacy to be at least that equal to that of clozapine, and demonstrated a minimal liability to cause side effects. Most importantly are three separate placebo-controlled double-blind trials where quetiapine's efficacy against chronic schizophrenia was compared to other antipsychotic drugs such as haloperidol and olanzapine. The three trials showed a statistically significant difference in both the occurrence of positive and negative symptoms of patients treated with quetiapine as opposed to those treated with placebo.
Quetiapine is classified as a CYP3A4 substrate. Thus, when co-administering the drug with a CYP3A4 inhibitor, the quetiapine effects are prolonged. This is reflected in previous study, which showed that over a 4-day period, a CYP3A4 inhibitor, such as ketoconazole, had the ability to increase quetiapine serum concentrations by 522%. The therapeutic dose of quetiapine ranges from 400 to 800 milligrams per kilo of body mass, and when this range is exceeded, drug toxicity occurs. The alpha-adrenergic and histamine receptors are blocked, causing hypotension, tachycardia, and respiratory depression and drowsiness. On the other hand, enzyme inducers have the opposite effect, reducing serum levels and the intended efficacy of the drug. A 2007 study observed and analyzed the pharmacokinetic interactions between quetiapine and various co-medications used in a psychiatric setting. The carbamazepine variable was the only noteworthy drug which was deemed unsafe to take with quetiapine. Due to the mild side effects of quetiapine toxicity, it is classified as a safe antipsychotic in terms of drug overdose abuse. This is important to consider as it's used clinically for those with conditions of schizophrenia and bipolar, where impulse and irrational behavior is common. Its efficacy in society is seen in acute cases of these psychiatric conditions, where it is used as a first line of defense to create a calm frame of mind and reduce behaviors associated with hypomania.